begin our final module with best practices of intervention and treatment, and this is out of the Wilkinson book, Chapter 7. I'm sure this is review for everyone, but we have to constantly remind ourselves of how incredibly diverse the population of folks under the spectrum actually is. And because of that, there's not a single best way to take the assessment information and develop it into what you know will be a very successful teaching practice. And so everything needs to be very individualized. There has been some empirical evidence about certain programs looking strong for many students with ASD. There's a lot of debate about certain controversial ones that I'm sure you've been aware of. But the bottom line is there's no single best teaching practice for students on the spectrum. So when looking at interventions, after we've looked at the information that our assessments provided, you have to be very cautious of some of the claims in the sorts of intervention materials that are published and obviously for profit. What's clear is that many of the treatments and many of the effective sorts of intervention or treatments have at their base very similar overlapping types of strategies that are used, that are the strategies that have been around for a very long time, very basic and mostly behavioral types of strategies based on behavioral science. So having said that, ABA is obviously then an integral part of many of these interventions. And applied behavior analysis, just for review, we talk about functional behavior analysis. The best way to remember it is to read it backwards, analyzing behavior to discover its function. Applied behavioral analysis is more comprehensive in looking at how do we take that functional information, apply it to the environment, and change the repertoire of behaviors our students have in an effort to eliminate challenging behaviors, but also use this methodology to teach what we might even consider to be content types of behaviors. I'd encourage you to look at the table on page 101 in Wilkinson, and it speaks to the several of the interventions, all of the interventions actually we're going to talk about briefly here, but it's a great kind of yardstick because they used a meta-analysis of the literature to rate the different types of interventions that we so often hear connected to the use of programs for students on the spectrum. Before even looking at those, it's, review again, but critical to remember that any intervention, just like any assessment, depends upon the factors that are listed here as far as being valid and effective. So the age of the student has to match the intervention, obviously, as well as their developmental level and their individual characteristics. And these are typically those characteristics linked to their specific behaviors related to their ASD. Then we need to look at the strength of the treatment. What is, the intervention's reputation from the research that's been done with regard to its effectiveness. And then lastly, the competency of the interventionist. Some of these interventions require, not necessarily extensive training, but definitely training. A seasoned teacher would need much less than other people might. But it does require that the interventionist often be very faithful to the way the training is designed. So consistency is critical. So again, best practice would say that because there's no comparative research that tells us exactly what to do, or says that certain things are superior to other things for any given student, we need to base the choice of the intervention or the treatment on that individual student's assessment results. Now, we're going to talk in a minute in another chapter about how useful some of our assessment results are to direct application for planning of lessons, but we know that we can use many different kinds of assessment methods to get the information we need to give it our best start. So let's look at those prominent approaches. The EIBI is the Early Intensive Behavioral Intervention Program. And as the title suggests, it's typically used with very young students, preschool, but it's moving into the schools more. It's very well established. It's probably the best researched program out there. And it is based on applied behavior analysis. So I'm sure if you haven't used it, you've heard of discrete trial training. That's a component of applied behavior analysis that's used in EIBI. It is incredibly regimented. Behaviors that we're teaching are broken into the most discrete pieces. It's very much like you would have learned with working with students with really significant disabilities, almost a task analysis of each very discrete step. And those discrete trials are done over and over again. And again, it's mindful of what we do with folks with significant intellectual disabilities because of their need for repetition. Positive reinforcement is used very consistently, and prompts are used very specifically. So it is a very scripted type of teaching. Some folks find it difficult to do this type of teaching because of the repetition itself for the teacher, but it has been seen to be successful with students, particularly very young students. And again, I'm seeing it in elementary schools now. You may be using it or seeing it yourself, but it has definitely moved into the school-age students' repertoire. Everybody's familiar with positive behavior supports, of course, and you'll notice that as we talk about these approaches, that these are certainly approaches used for other populations of disabilities. The positive behavior supports proactive bend on trying to deal with challenging behaviors is, of course, widely accepted and the best practice in schools for any type of behavior. And so our goal here, or more of our focus here, is what behaviors can we teach to meet the needs of the student versus how do we use aversive sorts of stimuli to extinguish unwanted behaviors. So as you all know, and you may very likely be teaching in a school that uses a school-wide PBS methodology. It can be school-wide, and then of course, if it is, it's also trickles into every classroom. And so the consistency across the entire building of this same type of behavioral intervention approach, or really this preventative approach, is very useful. We know anytime we're working with behavior, consistency, 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 because we've got to maintain, when we're using any sort of behavioral methodology, that very consistent reinforcement and not allow, that to slip away, because then you're at ground zero once again. PECs, of course, used in many different populations. So when we think of the picture exchange communication system, we think of students who are nonverbal, but we also use it in the case of students with ASD for highly verbal students because of their visual preference very often and their need for predictability, and it is a great way, even for students with language or limited language, to have that plan in front of them and the predictability that it brings. So it helps students to communicate more clearly. It helps them to stay on track and know what's coming next. It is a form of AAC, of course, and it can be very low tech or it can be high tech and used in, a technological talker, for example, the same sort of thing. You're probably familiar with the computer programs. There are literally PECs for anything you can imagine, action sorts of verbs, of course, all of the nouns and those kinds of information, but you can, in fact, communicate highly with PECs. I like to remind people that because of the wonderful technology we have, that it's awesome to integrate actual photographs into the PECs that you see produced by the computer program. Obviously, most often those are drawings, but students on the spectrum and other students with communicative difficulties should have photos whenever possible to have the most realistic pictures to exchange in the system. Um, Cognitive behavior therapy, been around for a long time. Initially, I studied this as a specific psychotherapy when I was studying to be a school psychologist, and it was used a lot in the clinical setting. It is a therapy that certainly teachers can use, and many teachers actually use it and just don't call it the fancy name. Basically, what we're doing here, and you're going to be thinking here of your high functioning students typically, is having the students use their own cognitive abilities to make behavioral changes. So you're looking at behavioral kind of influence on managing behaviors. In other words, using reinforcement. But you're having the student cognitively use a lot of self-talk, brings Vygotsky into the picture, to be their own kind of therapist, actually. So we can teach students to talk themselves through situations, to make the better choices, and control their behavior using cognitive skills as well. It's also a therapy that relies on problem solving, because a lot of the self-talk is about, and initially it is not self-talk, it's talk with the teacher or therapist. It's about how to solve the problem. So problem solving skills have to be a reasonable outcome. So again, higher functioning students typically targeted here for use of CBT. Peer-mediated strategies is a kind of overreaching generic term for many different types of approaches that you can use, where obviously the student's peer is mediating the behavior change. So it addresses a lot of things simultaneously in that way. The peers can be very excellent models for students with ASD, and also be valued models to the student. So we're helping them with their social interactions, and it's a very normalizing situation for them to practice new skills, social behaviors, communication among peers without an adult mediating it all. So it often, because it's in the natural setting, promotes far more generalization and maintenance of the skills than would happen otherwise. So these strategies, in my mind, are often more effective than a social skills training kind of program that's initiated by adults in a less than totally natural setting. But I always have concern when peers are involved about real careful choice of who the peer is, making sure that we're not creating a hierarchical relationship among peers, because that isn't our goal here. So careful choice of your peer mediator. Social stories have become very popular, and they can be very useful, and they can allow us to do a lot of individualization. They can come in any form of communication, so written, recorded, video, and they can be obviously authored by the teacher to address very specific situations or skills that you want to work on. So, what you're really doing is embedding those skills into a story that can be repeated. We even see social stories a lot in books for preschoolers. I mean, if you think about the kinds of things that even Mr. Rogers did, he was writing social